Hello, everybody, and welcome to the SME's Rapid Medical Response to COVID-19, a fireside chat. We're going to have some very interesting presentations coming up from some very knowledgeable and well-respected people. So I'm sure this is going to be a really exciting panel to watch, and we have an awesome moderator for it. We've got a couple of things to try and touch on beforehand. First of all, introduce myself. I'm Carl Decker with Metal Flow. I chair the Direct Digital Manufacturing Advisory Team of the SME. We are working on a direct digital challenge, a direct digital manufacturing challenge using additive manufacturing and how it's been applied to medical applications. So we'll give a little bit more information on that at the end, but we'd always love to welcome anybody that we can to enter that competition. Be able to submit your ideas so we can share more so the opportunities that might be available for AM to facilitate medical applications. I think you're going to find a lot of excellent information in this content coming up here, which will probably help give you some great ideas on how to do that. So wanted to mention that, and now we do have a couple of housekeeping things. I'd like to introduce Susie Marzano to give us a little bit of a rundown on that, and then we can dig into some of our panelists and start some kickoff.
Thank you, Carl. Before we started with our formal presentations from our panelists, let me cover a few housekeeping items. First, please make sure that you submit any questions, comments, and/or insights to our panel by using the chat box. Note that your microphones are automatically muted. If you have questions or comments, please use the chat feature located on the right side of your screen. We will be monitoring this feature and try to address questions and comments. We would like to make this panel as interactive as possible and would love to hear from you. Want to hear from you regarding best practices that you are also potentially implementing. Second, if you're interested in getting more involved in the medical AM and direct digital manufacturing advisory teams, please let us know as well. Third, we will be recording this presentation and it will be available on demand. Thank you again for joining us today, and I'll hand the microphone back to Carl to introduce you.
Excellent. Thank you very much, Susie. It is my great pleasure to introduce Amy Alexander. She is the Senior Biomedical Engineer at the Mayo Clinic, Department of Radiology, Anatomic Modeling Lab in Rochester, Minnesota. She uses advanced medical software to convert 2D radiological imaging data into 3D printed models. Amy is also the chair of the Medical Additive Manufacturing Advisory Team. A couple of things, not that they need to be said, but just to make sure that everybody gets some understanding. She has been a longstanding member of the RSNA's 3D SIG, helping get a lot of the medical applications approved and embraced through a lot of the hospitals and even medical insurance capabilities out there. She is also a recipient of the Outstanding Young Manufacturing Engineer. So I don't know if she wants me to say this, but we might be able to call her Amy Oimi. But she has done an amazing amount of additional work, and a lot of the things that she's done at Mayo Clinic are becoming standard practice for a lot of people to try to embrace. And I think that being able to hear some of her successes and some of her battles that she's go through are going to be interesting. She's going to help guide our panel of experts here to give us a great overview on a lot of the different things that are going on in the medical industry now, especially with some of the COVID things. And hopefully this will be a great means to give you items that you can consider for the digital manufacturing competition. So without any more ado, Amy, please take it away.
Thank you so much, Carl. That was a lovely introduction. Thanks to SME for hosting the event, inviting me to moderate. Special thanks to all of our attendees for taking the time out of your day to join us today. And a big thank you to our amazing 4 panelists, all of whom are members of the Additive Manufacturing, the medical advisory team with SME. I'll start by introducing Dr. Jonathan Ford. He's the Technical Director of 3D Clinical Applications at USF Health Department. He's in radiology, and also he works within Tampa General Hospital. He's an assistant professor, and in addition to his clinical and teaching duties at USF Morsani College of Medicine, he conducts research in 3D clinical printing. He's also an expert in finite element analysis and biomechanics. Next, I'll introduce Sarah Rimini. Sarah is the program director of radiology's 3D lab at Geisinger, which is a 14-hospital system spanning across Pennsylvania and New Jersey. In her role, Sarah leads an elite group of MRI and CT technologists in the processing of on-screen medical reconstructions. Additionally, she segments, designs, 3D prints, patient-specific medical models, and I believe surgical guides just recently to aid in pre-surgical planning, patient and learner education, surgical simulation, and surgical aid. Sarah has a bachelor's degree in medical imaging and is currently enrolled at Pennsylvania State University in their Master's of Engineering program in Additive Manufacturing and Design. Incredible. She is also an active member of the American Society of Radiologic Technologists, ASRT, SME's Medical Work Group, the American Society of Mechanical Engineering's 3D Printing Medical Work Group, and the RSNA 3D Printing Special Interest Group, or SIG. Next, I'll introduce Dr. Nicole Wake. Dr. Wake is the director of the 3D Imaging Lab at Montefiore Medical Center, an assistant professor of radiology at Albert Einstein College of Medicine, and an adjunct instructor of radiology at NYU Langone Health. Dr. Wake specializes in creating 3D images from radiological imaging data as well. Specifically, she has coupled MRI data with a range of 3D printing, augmented reality, and virtual reality technologies to create individualized, anatomically precise anatomic models for preoperative planning. She's using these models to guide patient management and is investigating the added value of 3D modeling in personalized medical care. Dr. Wake is currently the secretary for the RSNA 3D Printing Special Interest Group and is actively involved in the North American reimbursement efforts for 3D printing in hospitals. She's the author of numerous high-impact publications evaluating 3D printing in medicine and is an associate editor for the 3D Printing in Medicine journal. You guys are so impressive. All right, moving on. Our last but not least panelist is Dr. Godfrey Onwubaloo. Started his healthcare 3D printing career at Delta Additive Manufacturing in Canada, where he founded the company, which focuses on providing digital solutions to the medical, dental, and orthotics and prosthetics sectors. He recently co-founded the Center for Rehabilitation and Health Services, where he is the president and technical director. It is a Canadian company operating as a digital laboratory. It's involved in research and innovations, training of professionals in the healthcare industry as well. A blend of academia and industry. He previously worked in the manufacturing industry in England, held professorship position in manufacturing, and is currently a professor of biomedical and rehabilitation engineering and additive manufacturing. He has published over 140 publications in international journals and 11 textbooks. His doctorate degree in CAD, computer-aided design, of course, and practical experience in additive manufacturing have leveraged the work he does in healthcare 3D printing. He is a professional engineer as well. He is convinced that the potentials of additive manufacturing for the healthcare sector are the future. So with that, I will pass it back to Susie to get us started with our presentations.
All right, first panelist is Jonathan Ford. If we can go to the next slide.
Hello, everyone. Thank you again for that introduction. I'm Dr. Jonathan Ford. I'm the Technical Director of the Division of 3D Clinical Applications. Next slide, please. So I'm going to present on behalf of my colleagues. We are the 3D Clinical Application Division of the University of South Florida and Tampa General Hospital. My colleagues, Dr. Summer Decker, who is the director, and Dr. Todd Hazelton, medical director, have oversaw our COVID effort, and I was, of course, able to do my part as well. We've been around officially since 2011, but we actually have been doing 3D printing several years prior to that, but as an official capacity, 2011. Next slide, please. So this is about rapid medical response, and about last year, almost to the day, we found ourselves in a situation where we needed to have a rapid medical response with the COVID pandemic. This is going to be our story, and exactly how it proceeded. Around early March, we were getting rumblings from the provost and everything saying, hey, if you feel sick, stay home. They started transitioning people to work from home and whatnot. However, because of our clinical duties, we still had to go into the office. Traumas never stopped. Traumas actually got worse for a while during the pandemic peak because everyone was driving super fast because the roads were so clear. So we were trying to transition home, but we were not allowed, unfortunately. We had one case that came in from our trauma team on March 16th. It was a young individual who had multiple facial fractures. They requested a print, and we were able to model the relevant anatomy and then send it to print and then overnight. Next slide, please. At 5 in the morning, we were able to hand off the print to the surgical team. The very next day, while we were meeting with the surgeon, Dr. Decker got an email from the Dean of Medicine, and they asked us to see what kind of shortfalls 3D printing could answer. In the list that they provided us, plenty of protective devices like face shields, masks, some air filters, for the first half, as everyone knows, a lot of things were in short supply. One of the things was the nasopharyngeal swab that was used in COVID-19 testing. That one got our attention because we knew it needed to be produced by a clinical institution, a hospital, or a licensed medical manufacturer. We also knew because it's going to be used as a diagnostic tool, it's going to be under a lot of scrutiny. And so that presented a bit of a challenge for us. We tackled that. Next slide, please. So midway conversation, we excused ourselves from the surgeon. Dr. Decker got the one swab sample that they could spare so we can use as a reference. And we went back to our office and started designing. We looked at it and we knew it had to be patient safe, and so autoclavable was one of the demands, and we had an idea what would happen there. It had to be comfortable as possible. Unfortunately, no nasal pharyngeal swabs, the most delightful thing to happen to you. So we did it as comfortable as possible, but they're not. No one's lining up for them willingly. They had to grab enough of a mucus sample. It also had to be clinically viable, so it wouldn't interfere with the PCR testing, which is why you couldn't use a cotton swab or a cotton and wooden swab or whatnot. We also knew that had to be affordable and reasonable. If they were too expensive, they couldn't be produced, then we were not helping, we were just making more noise. Next slide, please. So we sent out actually a call to the RSNA SIG, 3D SIG, seeing if, hey, does anyone want to collaborate on this and work on this? And our colleague from Northwell Health, Dr. Todd Goldstein, who you see in this video, trying it on himself, answered and teamed up with us. He and myself, our colleagues in the infectious disease, all practiced swabbing ourselves with them, going as far back. I was a bit of a coward and I couldn't do it, so I swabbed a test swab with Purell gel and had my department chair swab me, and then the rest of the day I had Purell running down the back of my throat. So that was a unique experience. But so we all use them on ourselves before we try it on anybody else. Next slide, please. So we specifically chose the printer and the materials because since we are part of the 3D SIG, we have a general understanding of what are the common machines out there that most people have access to, because we wanted to have this as broad use as possible. So because we are such a well-knit, close-knit organization that we communicate a lot, everyone kind of knows what everyone else is capable of. So we wanted, again, the most bang for our buck. And as again, we knew that the device needed to be sterilely autoclavable, had to be recommended with a surgical guided resin, so we knew it was. And again, it was widespread. And next slide, please. We sent it to our bench lab. They tested it to make sure it was viable for the sample. It caught enough sample. It didn't interfere with any downstream PCR testing. And so from there, once they completed their test, we moved it to a clinical testing. Dr. Decker oversaw a multi-site clinical trial. We worked with several hospitals. Over several weeks, we were able to get fantastic results. The cycle threshold was actually statistically the same, and in some cases we found that the 3D printed swab was better than the current synthetic standard. From there, we were able to turn over our results, and several hospital review boards accepted the 3D printed swab as the standard of care for the alternative swab. Next slide, please. So we were able to manufacture them relatively quickly, roughly 300 swabs per batch. USF was producing around 60,000 swabs per month. Material cost-wise, they're about 25 cents per swab, and versus the standard of care, $1 per swab. And again, these printers are readily affordable and are already deployed across various institutions across the state, country, and internationally. So again, it was selectively chosen because we knew that most people would be able to use it. Next slide, please. We filed for a patent, original patent, on March 20th. The reason we did this was because we wanted to be able to share it with the world. We knew if we didn't patent it, someone else could block it and not allow it to happen, and we were all wanted to be able to sleep at night. And so we made sure we had the authority to be able to give it away for free, which is what we did. We hosted it on a Box website, and were able to work weekly with the FDA because we were under lots of scrutiny. Excuse me. We partnered with Form Labs to be able to distribute the swabs to hospitals and clinics that were beyond our legal bounds. We were only allowed to supply swabs to our own institution and our affiliates, which is why, again, we had to make sure everyone else had the ability to produce their own. From there, we ended up partnering with various branches of the U.S. military, and they were able to produce the swabs themselves as well. Next panel, please. Next slide, please. So, click, please. We had a global impact. USVA system, 25% of the 170 hospitals were using the USF Health Design swab. Majority of them were printing their own. Again, we were supplying to our local VAs who we had the affiliation with. We were told that it actually doubled the 3D printing in the VA facilities across the U.S. Click, please. Numerous states used the design. New York, Massachusetts, Kansas, Oklahoma, Ohio had over 1 million swabs alone at one point. Next slide. Thank you. Over 60 hospitals and hospital systems, including Mayo Clinic and Brigham Women's, LSU, joined the clinical trial and worked on the swab. I know Amy designed another one that was really impressive. Next slide, please. It's also was used in over 55 countries. And one more click, please. Over 70 million were actually have been printed worldwide, and which has shown how great impact the swab had nationally and internationally. The countries range from Malaysia, Ethiopia, Portugal, Uruguay, Canada, and we're all over the place. We were actually stunned how many places and how many emails we had to answer. We had at one point 4,000 emails in one day, just boom, right after the news story leaked, so we had to handle that. Next slide, please. We were able to accomplish this because we had a team where everyone came together, put everything aside, we're able to go multi-institutional and work towards the greater good. And these are some people that would not be possible of. These are not all of them. There are plenty of people that all played their role that helped and that we couldn't have done this project without. So we are eternally grateful for everyone who participated in our project. And we are still printing them, thankfully not as much, but for a while there we were sleeping at the lab, which was unpleasant. So thank you for your time, and I'll turn it over. If you have any questions, you can email us here at 3dclinicalapplications@usf.edu. And again, thank you for inviting me, and I look forward to any of your questions.
Wow. Thank you so much, Jonathan. Extremely impressive. Just incredible work. The 70 million number is blowing me away. That's really incredible. Thanks for sharing. We look forward to answering questions from the attendees. at the end. For now, I will pass it over to Sarah Rimini to speak about her work at Geisinger.
Thanks, Amy. That's a tough act to follow, for sure. But hello, everyone. Sarah Rimini, Program Director at Geisinger here in rural Pennsylvania. So just a quick rundown of our 3D lab. We're a fairly large health system smack dab in the middle of PA. We have 14 hospitals, as Amy stated earlier, but we started a 3D print lab in radiology in 2015, and those are some of our use cases. Next slide. So when COVID came around, we were trying to figure out what else we could use these printers for, and this video here is the first thing that I designed. So it's just a simple door pull with a little button on the end, so you can hit elevator buttons. Everyone can keep them on them. It's easy to clean. And the one time I was talking to a friend of mine, Mara Hittner from Matter Hackers, and she was talking about starting a COVID maker response hub, and this kind of came to mind. And what they were doing were hooking people up in the hospitals with maker spaces and makers to donate some parts. So she got us hooked up with 3DP Pittsburgh, and they actually donated a decent amount of these to our hospital that we got to use. Next slide. From there, we moved on to pretty much every hospital, what they were doing as well. So mask adjusters to save everyone's ears from rubbing the mask on the back of the ear there. And then we went into face shields. The 3D Workstan face shield was the one that we found the most effective, just because it was really fast to print, and we could get those transparencies and just punch them very quickly and make a makeshift face shield so that there was no droplets getting on, you know, our frontline workers' N95s and protecting their eyes as well. Next slide. So once we started printing face shields, I was trying to think of other things. What else can we do? What else can we help with? And I was down in MRI the one day, and these are some of my good friends, and they were talking about their N95s, how they had to keep reusing them, and it was fine, but the straps kept loosening up or breaking, and then you're getting a whole new mask just because the straps aren't working. So we started working with Matter Hackers as well on this one, and trying to figure out a strap design that could work on all the N95s that we offered in our system. And then on the right top here is our chairman, Dr. Patel. He tried both of them and fit tested, and they were good. But fortunately, we didn't have to use this design, but it was really nice to use AM for prototyping this. Next slide. Then we kind of went into what everyone else was doing. How can we make masks if we start running out? None of these were used clinically. These are all just prototypes, but 3D printing, and then silicone is really easy to autoclave. So can we make some sort of a mold that can suction to that person's face and get that really nice seal? What kind of other materials can we use? So we kind of ended up with a silicone mask with a plastic housing for where your N95 goes, or even if we have some kind of material, I made a mold that can just pour the gasket around that as well, and it just seals up really well. Next slide. We got a ton of community donations as well, and I just wanted to put this in there. I'm sure a lot of you guys know this, but anywhere from the face shields, the transparency sheets like that, tons and tons of garbage bags full of them that everyone was so willing to help with, to lunches for our technologists, our frontline radiology workers, to hand sanitizer. And it was just a very constant, overwhelming feeling of the community and how they're helping us and how they care for us. So how can we return that favor? Next slide. So we came up with a face shield donation system. We worked with Mara at Matter Hackers as well and kind of came up with the TOMS model. So we had enough face shields, and we were able to donate filament for an additional 5,000 face shields to be sent to Geisinger. But when we did that, we also wanted them to donate an additional 5,000 to other local hospitals that aren't in our system that couldn't get them, nursing homes and EMS groups. And that's pretty much mine, short and sweet.
Incredible. Thank you so much, Sarah, for sharing your experiences with us. Just the work that you guys did to meet the need of your hospital colleagues as well as the community. And shout out to Matter Hackers for working with Sarah and a lot of people in the medical 3D printing group to make some donations from that company. It's been really inspiring to see people step up to the plate. All right. Thank you, Sarah. We are now going to hear from Dr. Wake from Montefiore and NYU Langone. Go ahead, Dr. Wake.
Thank you for having me. So I'm going to talk about our experience 3D printing during COVID at Montefiore, where I'm the director of the 3D imaging lab. Next, please. These are my disclosures. Next. And everybody's familiar with this, but I just wanted to highlight the timeline of cases, and New York was one of the hot spots. So we had in April of last year, almost a year ago now, we had our first case in New York City, and in April we had about 145,000 cases. This year we have 834,000 cases and 31,000 deaths. So still ongoing, continuing, unfortunately, and we're really glad that 3D printing was able to help during this time. Next, please. This is just a picture of our lab and what it turned into during COVID. So normally we do 3D image reconstructions and 3D printed medical models specific for each patient, but we've really transformed into a manufacturing facility, manufacturing 3D printed models. Next, please. And similar to what Jonathan and Sarah have already shown, we printed a lot of nasal swabs, which we didn't actually use in-house, door openers, face shields, and mask prototypes. Next, please. And this is just the typical 3D printing workflow. So from a medical image, we do image segmentation, we do CAD modeling, and we do 3D printing. They're one-offs. We make sure, that this model is perfectly matched to the anatomy. We spend a lot of time on it. It's very different from what we did during COVID, where we wanted to print as many things as possible in a short period of time. Next, please. Can you play the video for me, please? Just click it. So this is an example just of 3 face shield holders printing on the Ultimaker. So where we would normally print like one model at a time, we're printing 3 face shield holders at a time, and we had to look at all the print settings to try to see if we could maximize like the print time. So looking at the printer speed, the layer thickness, the nozzle size, things like that we really never even thought about before. So that was just something different to consider. Next. We were very fortunate as well, similar to Sarah. We had a lot of community donations. I've just shown a few here from some of the big vendors and Ultimaker and Matter Hackers, like the whole 3D printing community, and even like people, makers within the community came together and were really helpful in providing additional items for us at Montefiore. So we really appreciate that. Next, please. And then for our face shields and other items, if we did give them out, we included instructions for use. So for example, for the face shields, we included the cleaning instructions and we packaged them up and delivered them to different units. At one stage, we did have PPE being handed out at the front of the hospital, and like our 3D printed face shields were included in that. Thankfully now we're not back to normal, but there isn't quite such a need, so we're very thankful for that and hope that it doesn't return to what we saw last year. Next, please. This is just a table of our initial face shield distribution, so you can see that during the first few weeks we really ramped up, and then I think our supply, everybody in the hospital had them, so we went down a little and then we continued. We still have a supply and still hand out face shields now. And sometimes it's because of a shortage within whatever unit. Maybe the ordering system is a little backed up, but sometimes the individuals actually like these better and they say that they're more comfortable, which is very interesting, something that we never thought about before. And I had a few people actually that were allergic to the foam that is on the normal face shields, so they request just the plastic ones. We found that pretty interesting. Next, please. Oh, next. That was just our grand total after 5 weeks. So I have a chapter actually in this new book that came out called 3D Printing in Medicine and its Role in the Pandemic. And so if you want to read more about the Montefiore 3D printing experience during COVID, I encourage you to download that and read that or order that. And next, please. I really want to highlight that it was a team effort. There was a lot of people like within Montefiore itself, radiology, residents especially, that did help, put face shields together, do the distribution, help with the printing, and then makers and engineers people from the industry really came together to support this. So it was really a very big team effort. And that's all I have for today. Thank you for having me.
Thank you so much, Dr. Wake, for sharing your experience. And this has given me all the feels, you guys. This is so cool to hear about the way that communities came together and helped each other out, and companies and hospitals working together to, create something to alleviate some of the pain we were all feeling at that time. All right, our final speaker for today is Dr. Godfrey Onwubolu, and he is going to come from us from CREHS Inc., the Digital Solutions in Health Services. Godfrey, go ahead and take it away.
Right. Okay, next page, please. Next page. Right, so here at the Center for Rehabilitation and Health Services in Canada, we are involved in medical, dental, as well as orthotics and prosthetics application of additive manufacturing. We actually own a lab, in the area of digital dentistry, whereby we, give solutions, digital solutions to different clinics. And we have, of course, a Sprint Tray 3D printer. We do believe that, that is the way forward in this particular area of the 21st century. Next page, please. Next page. Right. This page summarizes, our approach to rapid medical response, during COVID. We look at, timely networking, which was the first step that we took. We also consider situational analysis, just as listed, our goal, and the kind of education that we're involved in, and some were, our philosophy for contribution of knowledge towards the area of PPEs, as well as, venturi valve for ventilator systems. Next page, please. Right. So what happened is that, this page tells us roughly the scenario here in Canada, in Ontario, where we live. On March 17th last year, there was a lockdown, in the whole of Ontario. But then, just if you look at the date there, just 11 days thereafter, we decided to reach out to other organizations, other individuals, to form a team so that we can go into the area of 3D printing, 3D printing of medical devices to support solutions in the area of COVID-19. So 11 days after the lockdown, we took some steps, networking and moving ahead. Instead of working on our own, we wanted to collaborate with other individuals. Next page, please. Right. So what we found was that some groups were working on their own. They were not ready to share their ideas. Others were, quite liberal. They were open to working together with them. And of course, what we did was to also work on our own and connect. We had to connect with some other groups, some other individuals, those who are really interested in working together as a team, because that's very important as far as supporting what was going on at that particular time. Next page, please. Right. So what we did was to look at some areas of applications. We found that, first of all, face masks were quite popular, needed, as well as face shields. But then there was also the need of ventilation valves. So we had to zoom into these three areas to find out designs that are out there. So we did quite a bit of search to find out solutions, especially in the GrabCAD website. But we got a little bit concerned because we found that while you have a lot of face masks as well as face shields out there in terms of design, even ventilator valves, that they were mainly OBJ files, which step files or OBJ files, 3D OBJ object files, which could not be which could be 3D printed, but you cannot actually make any changes to them because a lot of people were sick. What we needed was to be able to get some designs and make changes to those designs to suit what was going on. But then, because they were just, ready to be printed, that limited the way of actually helping a lot of individuals who had specific needs. Next page, please. Right. So what we now did was to focus on creating a database, right, whereby we have solutions for face shields, for face masks, for venturi valves that will support ventilators, that designers could could change, could make changes to, so that they'll be able to reach out to more people that are actually in need. So that was the focus, to have a database of solutions that could be, could be changed. The designs could be changed. Next page, please. Right. So what we then did was to get 20 engineering graduate students who since I'm also a member of a faculty, so we brought those engineers to be able to address these different products, face shields, face masks, as well as ventilator valves. Also, we have even 17 engineering graduate students who are also continuing, because pandemic has not stopped; it's still on. Next page, please. Right. So, like I said, the focus was to have a database of editable designs. That's key. Editable designs are key. Next page, please. So, in terms of face mask, we searched through all those, those bullet points that are there, different sources, different designs that were there. But like I said, we got stuck because they were STL files. So we just left those. Yes, next page, please. And then this is what we're looking at. So this is our design. So those two, top left and the bottom right, are one of the several designs that we came up with, because the key, our goal here was to have designs that we can adjust, we can make changes to, which could be made available to other end users anywhere in the world. So these are our designs, and there are several of such designs that we have apart from these two. Next page, please. Same with PPEs, same with face shields. We also, we have some bullet points there, different sources that are there, but as you can see, there are many STL, and STL does not really help me or help individuals, because they're already stereotyped. We wanted to get some design that we can actually, make changes to. Next page, please. And so what we have is one of the several, face shields that we have in our database, so that designers can use this and make adjustments to them, and that's key. Next page, please. Then, of course, we consider the venturi valve for ventilator systems. There was a story about, especially in Italy, where quite a lot went on, and of course, we had to now focus on. Again, you can see there are many STL. We have to now look for a solution that we can make changes to, and that is now where we have the next page. Next page, which this is editable. This is not our design, but this we can, this is this is a product that we can make changes to, and of course release the design to a lot of individuals for fabrication, or for 3D printing. So those are the three areas that we focused on, and our focus was on having solutions that end users can actually make changes to, and then come up with their specific design that will meet the requirements of people that are sick. So that's exactly our contribution during the COVID period, and it was very, very useful, because we now have a suite or a database of different solutions that are available for end users, which also helped during the period of this 1 year of COVID. Right, so I'll hand over to Amy. If you have any question, then of course you ask.
Dr. Onwubaloo, thank you so much for the presentation, for taking the time to explain all the things that you have been up to over the last year. At this time, we'd like to invite questions from the attendees. Anything that's on your mind that you'd like to ask the panelists, now is a really great time to put that in the Q&A section of the Blue Jeans application. I'm going to start with one. This is from Mara Hintner from Matter Hackers. It says, as a community, we are all looking back at these events from a year ago. What is the mood on your teams? Is it pride, sadness, maybe little shades of PTSD, planning for future emergency responses? And I think I will shoot this to Nicole first, then we'll go through the rest of the panelists, because it's a fantastic question. So Nicole, what's the mood on your team at Montefiore?
Yeah, so our mood is, we're very proud and happy that we were able to use 3D printing as a stopgap solution to, fill the needs of very PPE and other devices, things that we needed in the hospital during such a obviously crazy time in the world. Now we have a little sadness and PTSD, both of those. I think, like, when somebody comes to the lab in full PPE, everybody's still like, oh wait, like, please stop here, like, don't come in, because they're afraid that, like, they still have COVID on them. I think we're still going through it, so we haven't planned yet for any future emergency responses, but I think we will do that at some stage.
Okay. Sarah, how about you? What's going on with your group?
I think it kind of goes in waves. We had like really good community response and, go get them at the beginning there. And then when it wasn't going away, trying, at a loss for a little bit, but then with the vaccine and everything and us getting supplies again, we're back on track and, ready to kick this thing's butt. So, it's all over the place, but we're kind of we're in a good spot right now.
Great to hear that. Jonathan, what are your thoughts? How's it going at USF?
Thanks, Amy. It's a bit of a mixture, to be honest. We had a really long haul. For the first 200 days, we didn't have a weekend. We just worked. We had cots brought in, and we actually were sleeping in the lab for the first few months.
Wow.
So we are proud of the work we did and being able to help as many people as possible. But we are tired. Our day job didn't quit, so we still had traumas coming in, so we had to do that. Dr. Decker and myself both teach, so we still had to teach the med students and transition to online teaching because we couldn't do it in person. We still had our research going on. We hit the news, and because we were a public institution, people had our emails, and so some of the more fringe elements were sending us threats. We were told that we were in the pocket of Bill Gates, which I wish we had his money, but it didn't happen. Our department chair, someone from his church, forwarded him a pamphlet saying how we were implanting microchips. That's why the nasopharyngeal swabs had to be replaced. There was no shortage. So we were very proud of what we did, and we were able to help put in so many hours, and then having that come back at us was a bit disheartening. So it's a bit of a mixture.
Yeah, I feel you. Godfrey, what are your thoughts? How is your team doing now, a year into this?
Yeah, as you notice, I did mention that right now, currently we still have about 17 graduate, students still engaged, in trying to improve, especially, the Venturi valve for ventilators. So the work is on, but not as it was previously, but the work is ongoing.
Yeah. Okay, here's something to consider, and I again will ask all panelists this question. Do you feel that the pandemic has given you a little bit more of a platform or a stage to show your respective institutions what you can do with additive manufacturing in the medical space? I'll start with Jonathan.
Yes, most definitely, to be honest. It made us more visible, which was great. We were secret. We were kind of joking, the best kept secret in the institution. We were actually better known outside of our institution. But once that hit, now we are actually drowning in more work than we can handle. So it's so that benefit is great. And it also showed how not only can we do our normal clinical printing for pre-surgical planning, cutting guides, and whatnot, we can also address unforeseen needs like supply chain shortages. So that's great too. So it made us more visible, and that is an added benefit internally in the institution.
Godfrey, do you feel this gave you more visibility?
I wouldn't say it has given us here more visibility, but what it has done is to, again, to expand the different areas we can apply, AM, in terms of responding to needs. Because, if the situation wasn't there, of course, we would have just focused on our trying to, satisfy, dental clinics. But right now, we could see the possibility of expanding the scope. So that is what gives us joy.
Sure.
Yeah.
Nicole, what do you think about your work at Montefiore? Are people paying attention any more than they did before?
Yeah, absolutely. I think it gave us a lot more visibility. Our 3D lab is fairly new and a lot of people weren't aware of it. Like similar to Geisinger, we have many hospitals within our system, so we only have our lab at one facility, but now other facilities are asking how they can get 3D printing, like facilities and printers on their sites, or how we can work that out. So I think it definitely increased our visibility, and we're getting more requests for anatomic models now, I think, because of it.
Wow. Sarah, what do you think?
Yep, I'll echo Nicole and Jonathan there. We're getting a lot of prototyping now because they know that we can do it, but we're also, our anatomic modeling requests have went up, skyrocketed because not a lot of people knew about it. We were, like John said, best kept secret in radiology. But the really cool thing I think about, one of the big things that came of this are people that are getting more educated in 3D printing and prototyping, things we can do, but also things you can't do. So what is not safe to print and use clinically. So that was kind of neat as well.
Awesome. There's a question here from Steve Morin from the VA in Minneapolis for Dr. Ford and others if you want to answer. So in the process of getting your 3D printed swabs approved for use, what do you wish you knew going in as you shifted from a healthcare provider to a device manufacturer? Go ahead. Yeah.
Good question. There's a whole bunch. It was a big learning experience going forward. One of the logistics was a bit of a nightmare because it just blew up. We didn't realize how many they needed to be produced from the get-go. We are lucky in that we have very vigorous checks and balances when we process any clinical case. So we had that good manufacturing practices in place. But we are a relatively small group, manpower-wise, and any potential pool that we could draw on was denied us because we work a lot with our med students and our residents. Our residents were busy reading. Our med students we weren't allowed to use as manpower for safety reasons. They didn't want them being exposed to COVID. So that's why we had such crazy hours because it literally for the longest time there's 3 of us or 4 of us sometimes. Eventually, once they started shutting down the hospital for elective cases, so we ended up getting volunteers from our surgeons who had nothing to do. So that was great. We had very expensive volunteers for a little bit, but then they were going to shut the hospital down and start laying off people because they didn't have access to testing. And because we were able to do the swabs, we were able to then reopen the hospital, and we were told there was like a list with a bunch of names that were going to lose their jobs had they weren't possible not to be able to open. That was one. Clinical trials, that was we don't have to do a lot of clinical trials, at least our department doesn't. We usually collaborate with a lot of the other ones, and that was a trial by fire to do like a multi-site clinical trial and learn as we went. I wish I knew that more as well. So there's my answer. I'll cede my time so I don't hog it all.
Would anybody else like to chime in? Things you wish you knew as you transitioned into a device manufacturer?
I guess I can say like one thing that like many people, including myself in hospitals, like we've never been device manufacturers before and never worked for a company before. So there's a lot we have to learn.
Yeah, I feel you there. Okay, I have a question for Dr. Onwubaloo. Godfrey, what types of files are in your database? Are they mostly the SolidWorks step files? Do you have AutoCAD, Creo, etc.?
SolidWorks.
All SolidWorks.
SolidWorks, yeah.
Yeah, okay. Do you find that there's a barrier for someone who doesn't have the means for a SolidWorks license to access the file, or is there a way to pull them down without using SolidWorks to transition into a printable file?
Right. No. If it's going to be transitioned into printable file, of course, it has to just be transformed into STL.
Yeah.
But they are, the way SolidWorks goes is that there are some older versions of SolidWorks that are just there, on the internet, which you can, just download and use. But if the files are created recently, then of course it might be an issue.
Okay.
Right. So the way it goes is that if you are using a SolidWorks 2020, but if the design was done 2 years ago, you should be fine. But if the design is done right now and you pick up a SolidWorks 2020, which is an earlier one, it will be difficult to open a more current one. That's the only snag.
I pay for my SolidWorks, so I'm gonna have to look into that.
Yeah.
I have a question for the panelists, based off of kind of what I'm experiencing currently. Do you have any fears or any nervousness around the fact that you have shown your institutions that you can produce medical devices? Do you feel like it could be opening the barn door for an excuse to request more of a medical device versus what we're all built to do typically in our hospitals, which is anatomic models and guides? For example, we have a new request to print something that is unavailable through supply chain just recently, and the question is, do we proceed this and work with the FDA to list this second device in addition to the swab, or do we say, that's really not what we do here? Do you think that that's cause for concern? Jonathan, you're doing this.
I was debating my answer. Sorry.
Okay,
So absolutely,
I know. It's a difficult one.
we already got several requests, and we're open to it, but and we already do several device design anyway. We have several patents on a couple other applications. Usually that's done through like one of our research groups and whatnot. But we're open to it. What we don't, because we are under such a pressure cooker of for this swab, that we don't want to overpromise and underdeliver. There are certain things that happens is people say, "Can you 3D print this?" And it's like, yes, we can, but that's not the best way to design what you're asking for. So that is a factor. It's like, yeah, we can 3D print that and maybe we can patent it, but regular manufacturing processes is better in that instance. Like air filters was a huge thing. People wanted us to start making their own air filters. I'm like, we can 3D print basically a snap piece, but the internal media is like, that's not going to be a 3D printable thing. You're going to have to get that from somewhere else. So it's a mixture. And how to pay for it, because they always think, well, hey, it's free. I'm like, no, it's not free. We're supplying it ourselves right now. So
exactly. Yeah, Steve in the comments, Steve Moran from VA just commented. He said, we're describing Pandora's box, and to quote Sarah Ramini, there are some things you shouldn't do. So can does not always equal should. And I think we're kind of at this precipice of making that decision on what point of care manufacturing is and why we do it, right? Sarah, or Nicole, what do you think?
Yeah, absolutely. I think there are a lot of different technologies, and sometimes 3D printing might be the best solution, but oftentimes there are many other ways to manufacture something. So we definitely have to consider that. And then I also have the problem where people think the models are free, and like, where does that money come from? And also, you need a lot of people to generate these models, from the design work to the actual printing process to the making sure you have the right materials on hand and that your printers are actually working the way that they're supposed to. So there are just a lot of things to consider in the whole workflow for creating a model or even a medical device.
Yeah. We had two really great questions come in. So I'll start with the first one. Can you describe how you worked with public sector partners? What were some of the barriers and challenges and opportunities that you see moving forward given this experience?
Hey, it's Nicole. I can start. a lot of people actually reached out to us and wanted to help. Like a lot of people we weren't allowed to go anywhere, and they had printers, you know, in their offices or in their homes even, and they asked, like, what can we do to help? Like, what do you guys need? We heard there's such a shortage. So we're really grateful that, you know, to have such a friendly community, and a community that wanted to help. I think that was really wonderful. And thank you, everybody, even people on this call today that helped us in New York, like at the very, very beginning.
I agree, Nicole. I can chime in too and just say, everyone as a community was so helpful, but some of the barriers, I mean, shipping obviously was one huge thing to try, and people wanted to donate, but if they were far away, it was really delaying getting things to us. Another thing was cleaning everything. So just assuming that everything we got as a donation had COVID on it before we brought it in the hospital. How can we safely bring these donations in and supply them out safely too? But for the most part, it was amazing, the community effort.
And most people on this webinar probably remember the PLA shortage of April and May 2020. Remember that?
The PLA shortage and the clear sheet shortage.
I was contacting all my friends who are teachers, saying, do you have these in a storage closet somewhere that you could potentially donate? I remember that.
Right, or like going to like every single Staples or Target or this or that, and all the facilities were closed, so like you couldn't manufacture them yourself. It was not
finding bakeries that had the transparency sheets for cakes and things. Yep, trying to find other ways.
That's right, Sarah. That's incredible. Very resourceful. We've got time for one more question, I'm afraid. I would love to keep talking all evening. And Vesna went ahead and put in the chat that every attendee and panelist is welcome to join and continue the discussion on Discord. She's got a link there. It's a new social media application. So if you have the time or opportunity, please do join us there. The last question I'll ask the panelists here. Does anyone have a rough estimate of the total quantities of healthcare equipment produced using additive as a percentage of the total or traditional equipment consumed to date during the COVID-19 pandemic in the US or North America? And I think if anyone can answer that, it's probably Nicole, who literally wrote a chapter of the book on the COVID response. Nicole, do you have any idea about like what dent did we make as additive manufacturers?
Actually, I don't know the answer to that question. I think each individual institution or people were keeping track, so I still have a record of, you know, how many face shields were printed and how many were handed out. But I do not know from our hospital even how many we purchased, because that's a whole different team, you know, and how many in general we use, because we have so many employees all around. But I think that's a very interesting question, something that we could definitely study if anybody's interested to do research on that.
You know, that would be a fun paper.
Yeah, absolutely.
Traditional manufacturing versus additive for the COVID response. Any volunteers to write that abstract? Godfrey, do you have anything to add on this?
Yeah, well, I think, you know, what I have to say is that it's a good idea for us to look at that as an area of research. If we can collaborate, you know, to make some contribution, you know, find out exactly, come up with some quantification that will be useful.
Sounds like we'll be discussing that at our next additive manufacturing medical work group meeting.
Yeah, looks good.
Okay. We're really winding down here, so I want to thank all of the attendees, thank, of course, all of the panelists, and thank SME, Vesna, Carl, Susie, everybody who participated in this. I do know that it is being recorded. I'll pass it back to Susie if there are any other housekeeping items before we adjourn.
So I'm going to pass it over to Carl. Just let me say thank you very much to our amazing, our moderator and our panelists. And it's very inspiring. It was incredible work that all of you did. And we're looking forward to obviously meeting in person to learn more. And I am going to pass it to Carl. Thank you.
Susie.
Okay. Thank you very much, Susie. Amy, tremendous job there. great panelists, excellent content, amazing how much information went through in such a very short period of time. It's kind of flattering, just awe-striking of how much was actually done and how much effort had to get put in to make all that happen. Now, are there ways that they can get more engaged in some of this? I know you mentioned the Discord.
Yeah, right after this, we will be joining, a few of our panelists will be joining the Discord link that Vesna sent in the event chat. Go ahead and make a copy of that right now while you have the webinar still open if you're interested in joining. I personally, this is the first time I'm going to use it, so I'll see you guys there. And thanks for joining us, and take care.
Yeah, no, I appreciate that. I'm sure we'll probably have a lot of people interested there, and I really hope that it's a good opportunity to connect with everybody. Again, we have direct digital manufacturing competition, which is being targeted towards medical products that have helped the COVID situation, or any sorts of medical products. And we'd really love to see a lot of great entries that can hopefully give people more innovative ideas on how to be able to advance and take their skills to the next level. So we look forward to that. Look forward to additional content and more information on all the amazing work that everybody is doing here, and a lot of the stuff that's to come. So do want to appreciate the SME for being able to host this, put it on so that we could share all of this. Thank them for it and all the hard work that's gone into making this possible. So thank you for that. Thank you all of our presenters. And if there's no additional items, I believe that'll bring us to a close.
Thank you, Carl.